Hello, my name is Rob Goldstein. I'm an exercise physiologist certified by the American College of Sports Medicine. Welcome to Exercise Prescription for Diabetes, and thank you so much for giving me the opportunity to work with you to help you with your exercise program. I've really had a great career working with very many people that have had diabetes, whether it be type 1, type 2, or pre-diabetes. But also I've worked with all different levels of exercisers, with people that are currently exercising to people that have had difficulty starting exercise programs. In this video, we will give you information to help get you started if you're just starting a program or if you've had difficulty. If you are already exercising, you're definitely going to pick up a couple of things that are going to help your program. I've had great success with people, but my biggest success is understanding my clients' success and looking at the successes that they've had in their lives, whether it be business or education or being a parent or being a husband or a wife, different successes that people have every day. So I want to look at your success and just say that exercise is going to be another area that you will be successful in. Hello, so I just want to go into exercise prescription and why we call it exercise prescription. Basically, the reason why is because diabetes is a metabolic disorder, but more importantly, or as importantly, that as an exercise physiologist, I work together with your treatment team. I'll work with your physician, I'll work with your nutritionists, if you're seeing physical therapists or orthopedists or other type of doctors, we all work together coming up with one prescription for you so that you're able to reach your goals. The other thing why it's a prescription is because every individual is different. So every time I work with somebody, it's a totally different scenario, and the program is based totally individually for you, but also incorporating all your other clinicians as well. Hello, yes, although I am an exercise physiologist, I'm not a physician. So I do have a very good background in developing programs for people with metabolic disorders, but I also would encourage you and ask you to go back to your physician before starting an exercise program. They're more than likely going to be thrilled that you're ready to start an exercise program, but the most important goal that we're always going to have is safety. So your physician would come up with maybe contraindications. Say you have an arm injury, they may say, well, don't lift anything above your head. Or if you have difficulty with different orthopedic lower hip or knee, they may say don't do any weight-bearing exercise. So it's always good to check with your physician, get their blessing on your exercise program, and you're good to go. There are so many benefits for people with diabetes when they exercise. There's so many great things that happen. A lot of them are reducing risk factors, say as blood pressure. It can help increase your HDL cholesterol through exercise. It can help lower your heart rate. It can help lower your blood sugar levels. Naturally, weight loss is a huge one. As we get older, for people in my area, and what we're concerned about also when we get older is keeping the structure stronger, so we also reduce risk for fall. I've seen people come off medications, as they've lost weight and they've increased their exercise. Naturally, that's a good goal, but anytime you're going to change your medication or come off a medication, that would have to be done through your doctor. But I definitely have seen it, but that's always between you and your doctor. So the benefits are many, and we're going to get started, and we're definitely going to hit some great goals together here. There are so many benefits for people with diabetes when they exercise. There's so many great things that happen. A lot of them are reducing risk factors, say as blood pressure. It can help increase your HDL cholesterol through exercise. It can help lower your heart rate. It can help lower your blood sugar levels. Naturally, weight loss is a huge one. As we get older, for people in my area, and what we're concerned about also when we get older is keeping the structure stronger, so we also reduce risk for fall. I've seen people come off medications, as they've lost weight and they've increased their exercise. Naturally, that's a good goal, but anytime you're going to change your medication or come off a medication, that would have to be done through your doctor. But I definitely have seen it, but that's always between you and your doctor. So the benefits are many, and we're going to get started, and we're definitely going to hit some great goals together here. There are so many benefits for people with diabetes when they exercise. There's so many great things that happen. A lot of them are reducing risk factors, say as blood pressure. It can help increase your HDL cholesterol through exercise. It can help lower your heart rate. It can help lower your blood sugar levels. Naturally, weight loss is a huge one. As we get older, for people in my area, and what we're concerned about also when we get older is keeping the structure stronger, so we also reduce risk for fall. I've seen people come off medications, as they've lost weight and they've increased their exercise. Naturally, that's a good goal, but anytime you're going to change your medication or come off a medication, that would have to be done through your doctor. But I definitely have seen it, but that's always between you and your doctor. So the benefits are many, and we're going to get started, and we're definitely going to hit some great goals together here. Yes, there are many great benefits to exercise, but I'm not dismissing at all that sometimes it's difficult to get started in an exercise program. So oftentimes what I work with as an exercise physiologist is I try to come over barriers that are sort of hindering people from starting an exercise program. So I'm going to go over a couple of those now. So oftentimes there's time. All right, people are working, they're parents, they're grandparents, they may have 2 jobs, they may have other obligations. So the thing with exercise is it can be done in short bouts of time. You could mix it up during the day, and it all adds together and does well. So people often think, well, I need to do like an hour. Well, if you don't have the time, you could do a little walking at work. The other thing that happens often is sometimes people are exercising and they don't even know it. I'll ask people, what do you do for exercise? Well, I don't really do. But then they tell me they do yard work, they do dancing, they walk a lot at work. So oftentimes people are exercising and they're not even really understanding that they really are doing exercise. All right, another barrier to exercise, and the hardest thing, and this is sort of like what I do as an exercise physiologist, is I teach people how to exercise. Oftentimes people don't have an idea of how to exercise or what they should do or how long they should do it or how hard they should work out or how many times a week. And this is the type of things that I go over with people. The other thing that I do with people is I start them very slowly to get them more confidence, because a lot of this, as I talked about, we're talking about successful people in your own right. So once you sort of see that you can do this and that you're able to do it, you gain the confidence and it becomes easier to do. Naturally, another barrier is always going to be money. I mean, unless you're independently wealthy. So, which I am certainly not. All right, but money is an issue. All right, so I mean, joining gym can cost money. Some gyms are more expensive than others. So what we're going to do here today is I'm going to come up with you with an at-home program that's sort of based on walking, lifting light weights, and stretching. So this would be very minimal, as far as the cost is concerned. So hopefully we can eliminate some of these barriers. So today I'm going to talk about a lot. We're going to talk about your exercise prescription. I'm going to talk about weight loss. I'm going to talk about blood sugar levels. And naturally, we're going to cover when people hit plateaus and how to get through those plateaus. I'm also going to do a little section on going over different metrics, because I think this is very important for people to understand while they're starting an exercise program. So to really understand cholesterol and the numbers and what they mean, and to really understand HbA1c and the numbers and what they mean. So we'll go over all of this, and we're going to get ready to start exercising. In this portion, I'd like to do some education with people. What I'd like to do is go over some common medical terms that you probably hear on a regular, everyday basis or deal with your physician on a regular day basis. So I find if I can educate people on some of these terms and they really understand it, it helps them with controlling their diabetes, but also is a great addition to their exercise program. All right, so the first term I'm sure that everybody has heard of is something that's called metabolic syndrome. Metabolic syndrome are 5 different risk factors that your doctor will go over, all right? If people have usually 3 out of these 5, sometimes your doctor then could determine whether you might have diabetes or pre-diabetes. All right, so the risk factors are, first one is a man who has a waist over 40 or a woman who has a waist over 35 inches. The next one is moderate blood pressure, which would be 130 systolic over 85 diastolic. The next risk factor would be higher triglycerides, which would be over 150. The next risk factor would be your fasting glucose to be over 100. And the last one is your HDL, which is your good cholesterol, would be low and under 40. All right, but again, everybody's very different. So your doctor's going to look and see these risk factors. They're going to sort of determine other things that might be going on in your life or family history. And using this type of system, the metabolic syndrome, this can be helpful in your diagnosis. Okay, the next thing that I'd like to talk about is blood pressure. Oftentimes people can have high blood pressure and they don't even know it. They could be running around and you wouldn't feel it, so it's something you would never know. But high blood pressure can naturally cause heart attack or stroke or be very dangerous, but it's also a risk factor for diabetes. So ideally, you would want to have, let me just go over the 2 terms. The first number is what's called the systolic. The systolic is the heart while it's working, while it's pumping. The lower number is what's called the diastolic. The diastolic is the heart while it's at rest, but it's refilling. So ideally, we would like to have blood pressures where the systolic is under 120 and the diastolic is under 80. Once the blood pressure gets to 130 over 85, that's what's called moderately high blood pressure. So at that point, it would be something that you would want to take a look at and try to get it back down into that lower range. Exercise can help with that, but naturally working with your doctor, if you're on medications, taking a look at the medications can be very helpful. The next number is what's called stage 1 hypertension. And stage 1 hypertension would be the systolic, so the top number would be 140 to 160, all right? And the other number, the diastolic, would be 90. So anytime the blood pressure gets above 140 over 90, it would be considered high blood pressure or stage 1 hypertension. The higher that systolic number goes, also the higher the risk for stroke. So blood pressure is really nothing to mess around with. I'm just going to go into one more level. The next level is what's called stage 2 hypertension. Stage 2 hypertension would be where the systolic blood pressure is 160 or higher, and the diastolic is 100 or higher. Now, what I always recommend for my people that have diabetes, because blood pressure is a risk factor for diabetes as well, and we really want to make sure we keep this under control, is keep your regular doctor's appointments, go see your physician regularly. But oftentimes I just ask my people if there's any way that they could swing it to go get a blood pressure cuff to have at home and measure their blood pressure. Everybody's different. Some people may want to do it daily. Some people may want to do it 1 time a week. All right, but now you have an idea of where the numbers should be. And if you see the numbers creeping into that 130 over 85 to the 140 over 90, this is a time where you need to seek attention, and blood pressure is a very treatable illness. Thank you. Okay, well now I'm going to talk about cholesterol, which is always something that people have a concern with. It's a test you get on a regular basis. So I'd just like to go over some of the numbers with you, so hopefully we can clear up some of these things and it makes a little more sense. So there are a few numbers that you get when you get your cholesterol taken. The largest number is generally what they call the total cholesterol. The total cholesterol, you would like it to be ideally under 200. Once it gets under 200 and up to 240, it's considered high cholesterol, and naturally some people can even have higher than that, which puts you more at risk for heart disease and diabetes. All right, the next number is what's called the LDL. The LDL stands for low density lipoprotein. The The low density lipoprotein, this is the bad cholesterol. So your doctor would want this minimally for your LDL to be under 100, and more than likely, the way that most physicians are going now, but everyone's different and everybody is different, would be to have the LDL around 70. All right, another number, the next one is what's called the HDL cholesterol. The HDL cholesterol is the good cholesterol. So the good cholesterol we want to be as high as possible. All right, so the HDL cholesterol, if you can envision sort of like a Pac-Man going through the arteries and eating up all the debris and the bad stuff in the arteries, that's why we would want the HDL to be higher. So we want the HDL to be over 40, and we would even like it to be higher than that. If we could get it up to 50 and 60, that would be great. The problem becomes is that people that have diabetes and heart disease, one of the reasons they have it is because they're notorious for having low HDL or good cholesterol. The significance of this happens when you take that top number, which is say 200, and then say we take the HDL cholesterol, which is 40. What they look for is a ratio between those two numbers. So they'll divide the 40 into the 200. And naturally, if I divide 40 into 200, that's 5. All right, so at 5, you would be at higher risk for heart disease. You generally want to be under 3.5. All right, so there are different ways to get up the HDL. Exercise is definitely one of them. Moderate exercise can definitely help with that. Weight loss can help with that. Some people have really low HDL, and no matter what they do, it could be genetic. It's hard to get up. All right, so the doctor may prescribe some fish oil or niacin, but there are definitely different ways, and there's dietary things like adding fish and other type of foods that can help to raise the HDL cholesterol. So if you're in a gym, one of the pieces of equipment that you're going to find that would be very good to use was called a recumbent cycle. It's recumbent because it has a seat, so I'm seated on it just like I'm on a chair. So what this bike does is it actually takes, pressure off of the back, but also a cycle is what they call an open chain activity. So this is not weight-bearing activity. So this is excellent. You'll notice they use this in a lot of physical therapy for people that have joint issues or people that may have had surgeries. And a bike is a very good form of exercise to reduce weight bearing and take any stress off the joints. So the couple of important things with looking at a bicycle are the seating position. And oftentimes, a lot of times you'll see people, make like a big mistake with this. So as you can see now, what's happening, I'm riding, I'm like really close. I'm like really too close. And even you'll see people riding on the street and their seat is really too low and they're pedaling so much, but it's not really doing too much. All right, the other problem you could have is just the opposite, where the seat is too long and you're pedaling like this. I'm sort of exaggerating this a little bit, but I'm sort of like hyperextending the knee, and as you can see, I'm not really getting a lot of revolutions per minute. All right, so this is going to be really unproductive, and it can generally, cause injury if you're hyperextending any muscle. So ideally, where you want to be is you want to get the seat in a position where, I'm going to take it back, actually another drop, that you see the way my legs are now, so there's a little bit of bend in the knee, but not much. All right, so one of the other things, that we want to do when we're on one of these machines is if you come over here and you look at the screen here, there's a lot of different programs that are going on. All right, so you have a manual program, you have a fat burning program, you have a strength, you have an endurance, and you see all these lights going around flashing, and that could be very sort of confusing. So what I always like to do to start is do a manual program. All right, this way you have the control of what's going on. If you go into some of these other programs, the problem that you have is you can get into a program where you're pedaling, and say you're in a hill climb, and then all of a sudden it's like this incredible, type of force that you need to go up that hill, and it's sort of like a cross-training thing. Well, at first, you don't want that. So you want to stay in a manual program so it's safe. All right, the other programs, they're going to raise blood pressure very quickly. So I'm going to press manual. All right, I'm going to lower my minutes now a little bit. All right, so say we're just starting. All right, so say I'm going to do 5 minutes. And I'm going to try to stay on a lower level and do, just starting between 50 to 60 revolutions a minute. So you can see I'm going pretty easily, but I'm using a decent amount of force. All right, it's light on my joints. My back is supported. All right, and this is a great aerobic exercise. This is also going to work, the heart and deliver blood and oxygen back and forth to the working muscle. So I highly recommend a recumbent machine if you belong to a gym, because all these machines are different. Please talk to one of the trainers when you get on to show you how to run the equipment safely. And if you're going to buy a bike, whether it be on eBay or from Sports Authority or wherever you're going to buy it, you want to sort of make sure you're going to fit well on there, but also that it works properly and you could work at the intensities that you want to work at. Okay, so we've been through a lot. So we've talked about our exercise prescription. So we've sort of gone through our warm-up, our aerobic training. We've done our strength training. We've done our flexibility training. We talked about cool down. Went over some basic, body weight, body composition, and circumference measurements, as well as, doing a whole lot with education on HbA1c and blood pressure. So I'm sort of getting ready to wind down and to end, but a normal part of exercise that you may reach after you've been going for a while and things are going good is you may get to a point where you are going to plateau. All right, so you may, feel that, well, I've been doing the same workout, for like 2 or 3 weeks now. Well, with the exercises, it's always good to add to the intensity. You don't want to add that much, but to change it up a little bit. Sometimes you may even want to change exercises. So possibly you're riding on a life cycle, maybe from the life cycle you may want to go to the treadmill. The thing with the weights is sometimes we have a muscle memory. All right, so remember I did the bicep curl, and then I did the tricep, and then I did the upright row, and then I did the one-armed row. Well, we do have a muscle memory. So sometimes maybe if we change the order that we do those things, and it can be helpful. So we are going to plateau, so we can get through this by raising the intensity. Sometimes we're also changing up the exercises or adding new exercises. And I strongly encourage, that if people have sports that they like to do, maybe you're feeling fit, maybe you're feeling a little better, that you could incorporate maybe playing tennis or maybe going swimming, all right, or maybe playing volleyball or adding sports that, maybe now that you're feeling more active and have more confidence that, things that you may really like to do, and those are like really fun things. And again, the thing with the weight, it could come down, and then boom, it could just hit like a rock for a little while. So take those circumference measurements and get as many indicators as possible. All right, remember the benefits to exercise. We're looking to help blood pressure come down. We're looking to increase the HDL cholesterol. We're looking to help the blood sugar go down. We're hoping to get the weight to go down, but we're also just looking to feel better and feel more confident and change our lives and have a better quality life. So remember to start slow, start at your own pace. This is not a race. Again, if you're just starting, if you could do 3-minute walk to start, that's great. The important thing is to get started and to stay with it. So I hope this video has been helpful to people. It's been a pleasure for me to do. I really appreciate you coming out and giving me the opportunity to work with you. And my name again is Rob Goldstein, exercise physiologist, and thank you very much.